Are you suffering from pelvic floor dysfunction or chronic constipation? Well, just so you know, you're not alone. Millions of people in America suffer from these conditions. They predominantly happen in women. However, men can have this as well. A lot of this just comes down to how you have a bowel movement. And first, it's important to know how a natural bowel movement occurs. In your pelvis, and this is your sacrum, the backbone, you have your rectum that comes down straight, and then it angles out to your anus. Around this, you have a muscle called the puborectalis muscle. And that muscle is constantly pulling your rectum back, so it makes a strong angle so you do not lose control of your bowel function. Also within the pelvis, you have a muscular sling. It's called your pelvic floor muscles or the levator ani muscles, and these are the muscles that allow your body to hold the bowel movement and defecate when needed. So normally when you have a bowel movement, you sit on the toilet and these muscles release. The anus is allowed to then go forward and down. And once everything relaxes, able to have a bowel movement. Now, the problem comes in when these muscles aren't coordinated properly. And this can result in a condition called paradoxical puborectalis, anismus, or otherwise known as pelvic floor dysfunction or dyssynergia. So essentially, instead of your muscles relaxing and moving down as they should, they contract and everything goes up. So you're almost pooping against a blocked object, although it's just functional. There is actually not a blocked object. In order to start down the pathway on how to treat this, I often recommend performing a test called anal manometry, which is a small catheter that goes within the anus and can detect the actual pressure sensations within the anus. Next, there's a test called a defecography, which actually in real time under an MRI machine can look on how the pelvic floor is actually functioning. Combined with these methods, we can then possibly refer you to a specialized pelvic floor therapist who can perform different activities and even biofeedback to help retrain the brain on how to have a bowel movement. The majority of time, this pelvic floor therapy works very well. It takes about 3 to 6 months for you to see really strong and long-lasting effects, but if you stick with their program, it can be extremely effective. So I know this can be very challenging, and I know you may be embarrassed to talk about this, but please, these are important to your quality of life, and there are certainly options out there for you.